That approach will at least put the debate on a comprehensive plane, not to be picked apart by the special interests and the individual committees. Compromise could be overridden by principle and sound evidence-based practice by using this approach. Finally, we need to think about all of us again, not just ourselves as individuals. We need our legislature to think and behave the way they did when they voted to consolidate the legislature through reapportionment as they did in the 60s. Many legislators actually voted to put themselves out of business at that time. It was hard, very hard, but it was action on behalf of the greater good. Now for a final few comments about what's happening in Washington. The bill, as passed by the House, is bringing hope to the millions and millions of people without insurance. From the point of view that we have never really had a serious political discussion about a national health care program for this nation, from that point of view, the bill is a good thing. But the bill itself will bring disaster to our health care. Why? Let me count the ways. The bill does nothing to turn the health care mess into a system. It keeps all the dysfunctional parts of health care. It tries to fix the unfixable pieces parts. The budget balancing in the bill is a fiction. You can't cut Medicare by $500 billion and have our hospitals survive. Half of our hospitals in this country lost money last year. You can't even begin to control the costs unless there is a publicly financed way of paying for health care. You must have a system and control the money to control costs, and this bill doesn't even begin to think about it. Further, the bill is based on the Massachusetts approach, which mandates that businesses and individuals have adequate health care, or they will be fined in an escalating manner. Massachusetts now has the highest percentage of people covered in the nation, to their credit. But the price tag is now the most expensive healthcare system in the world. Their annual costs have risen since 2002 by 6.5 times wage growth. Vermont is bad enough at 3.5 times wage growth. Large company premiums rose 23% last year alone in Massachusetts. And to start fining people and companies for not having or providing health care, how low can we go? It is the makings of an economic disaster. Yet our Congress, just like our Vermont legislature, chose to ignore the evidence. The overall financial impact of the DC bill is frankly frightening to consider. There is the potential of even increasing our cost of health care at rates even higher than today, resulting in even more uninsured, more loss of providers, and more serious decline in the quality of our care. And the provisions of this bill, the important provisions, don't begin to take effect until the year 2013. If we wait that long, our health care costs will have gone up another 50% in that period. We can't wait. Solving the health care problem is the economic and social issue of our times. The unrelenting rising costs are threatening all aspects of our lives. We are in danger of seeing our high-quality care begin to erode. We will watch hospitals in Vermont go out of business, and we will see an explosion of the numbers of uninsured and underinsured if we don't act soon. In all in all, this is an issue that cries out for constant and intense public education and political will. Anything we can do to raise the heat and elucidate the stakes with Vermonters hastens the day when our political leaders cannot ignore common sense any longer. What is wrong with giving every Vermonter or every American a Medicare for All card and publicly financing our care? What is wrong with that? Why do we have to make this so damned expensive and complicated? Either we succeed on this front, or we face economic and social disaster as our healthcare capacity will systematically erode our personal and our public assets and more quickly erode its ability to serve us all. The future is in our collective hands. Thank you very much.